lived experience must inform reforms for all psychological injuries in the workers' compensation system. But to do so, we need to understand violence against women and the intersectionality as it applies to workers' compensation. Let's change the story. What I have with me is an injured worker and is going through the workers' compensation and is not going through the workers' compensation system. So Glenda, perhaps really briefly, can you tell us how you got injured?
It was a psychological injury where I was bullied and harassed, targeted. I was unfairly terminated from my position and ended up going to Fair Work, winning my position back, only to then be sexually assaulted.
What profession do you
I worked as a nurse.
Did you think claiming workers' compensation, you'd go into the system, you'd get medical care, a little bit of financial support, and then you'd go back to work? Is that how you perceived it?
I was hoping.
So do you think these organisations, such as CERIPH and all those insurers in workers' compensation system, do you think they take violence against women seriously?
Absolutely not.
Okay, so as a woman being diminished around sexual assault, around not being heard, not even able to tell your story, having it denied outright by an insurer, how does that make you feel?
Oh, I'm very bitter and angry, and 7 years is a big chunk of my life. Things have to change.
So Glenda, I just want to talk and clarify these claims. You have an existing claim.
Correct.
That is currently going through the mediation process, and you have a lawyer acting for you.
Yes.
Has the insurance company accepted liability for the claim?
The insurance company have accepted liability, yes.
You've got that in writing?
Yes. I have lawyers. It's going in the process of going to court.
And why haven't they paid you weekly wages if they've accepted liability? Have they given you an explanation?
No, they have. The insurance company have not contacted me. Even now, I don't have a caseworker, which is unbelievable. I have a live case and I have no caseworker.
Did you tell iCare?
iCare and CERIPH were made aware, yes.
And what did they do?
They've done nothing. One of the grievances that I have is that the insurance company's reasons for declining my claim is they state that the staff can attest to the personality that he would never do such a thing. That was their reason.
And did you get that in writing?
That's in writing.
So again, the question, when you got that letter and you opened it, how did that make you feel?
I was disgusted, hurt, betrayed. Considering they'd never contacted me for a statement, I was alarmed.
So you got a letter that said staff attested to his personality, that he wouldn't do such a thing,
And that
around an alleged sexual assault. Is that correct?
Correct.
Okay, so I just wanted to say to everybody watching this, what Glenda's describing is what happens to victims in the workers' compensation system. The runaround that you're given and you're hearing from Glenda quite literally does your head in.
I should have been interviewed by the insurance company. I should have been offered some mental health support right from the beginning.
I believe you got a letter from CERIPH that came, several years later, that said respond, because you complained about your complaint taking so long with them.
They had my complaint for 4 years. And I got a letter from them after 4 years when they shut my file, apologising that it's taken so long to address my complaints, even though they didn't, because they shut my file, and apologised because they have a 21-day policy of trying to deal with complaints. This is 4 years later. And I had no income, no support. I ended up losing my home. This was 5 years and being declined 5 times, and ended up selling my home. One of the bills that I ended up paying was for a psychologist, for mental health assistance, for a workplace injury that I've lost my home over.
Financially, how are you living at the moment?
I'm living off the last money from the sale of my home.
Can I ask, how is your mental health? That's an incredibly traumatic process.
I'm actually, just before we had this Zoom info meeting, I'm actually sitting here responding to more lawyers' documents. So it is just 7 years of this, no income, no resolution, not one department that I have taken really serious allegations to has provided me an outcome that I feel satisfied with, that I feel there's been a fair process, that I feel that I've been listened to. 5 years and 9 psychiatrists later, the Workers' Compensation Tribunal appointed a psychiatrist, an independent person who did deem that I had suffered a workplace injury, which speaks volumes of the 5 years and the 5 times I was denied. And I've lost everything. I've had no income.
So do you wake up with night sweats, or is your anxiety out of control? I mean, what you're describing, and your family life must have been so disrupted by all of this.
When I first was terminated, I had a week about arrangement with my ex, the father of my children, and we were amicable and the situation was easy. I was very depressed. When I first was terminated, I was up for 4 days without sleeping and writing everything down that I could remember. I was manic, I was panicked, I was worried, I was in a very bad way. I lost a lot of weight quickly. My children had decided that they didn't want to do the week about with me anymore and wanted to live with their father full time. My children were actually in high school at the time. They'd both gone through their HSC. I had no money to help my children with. The whole thing of this has been distressing. My father's turned 80. He has had a quadruple bypass. He wants to see the end of this. I want to see the end of this. I've always seen myself as independent. I've always seen myself as a worker. I enjoyed working. I loved my job. I feel now meaningless. I feel that I've been up against such a battle constantly that it has sucked everything out of me. And
so initially, before it ended up into all this legal action, who did you complain to?
so I had nowhere to take my complaint to. I did, however, contact CERIPH, the regulators for the insurance company. I sent them ample evidence. They pretty much ignored me. I ended up desperate. I sent them hundreds of emails.
Were those emails reasonable? Were they asking for help, like, please help me, please help me?
I sent them evidence. I asked them to review the situation. I reiterated to them that their role was to be involved in disputes with insurance companies. And I've been so desperate that I've had nowhere to take even the complaint against the regulator. They're a government department. I contacted politicians who their portfolio oversee that. At the time, it was Dominic Perrottet, and ignored.
Did you go to iCare and
Yes.
IRO and all of the others? What happened?
A massive paper trail of complaints to, it was WIRO at the time, and CERA and iCare. What I found is that each department pretty much just kept fobbing me off to the other department.
So, Glenda, what have you been diagnosed with? PTSD?
Post-traumatic stress disorder, just anxiety, just the whole thing. That none of these injuries should have happened. They were all preventable. It wasn't like I slipped over on a icy pavement and broke my leg. These are deliberate actions.
So, Glenda, if you were to say one thing to the Premier of New South Wales, who is responsible for the workers' compensation system, looking down the barrel of the camera, what would you say to him?
I have contacted him and he has ignored me.